Okay. Good morning, everyone. Can you hear me, Austin?
I can hear you. Can you hear me?
Excellent. Yes. Well, let's get started. Can you see my screen?
Yes.
Okay. And let me switch. Excellent. Okay. Well, so my name is Gerardo. I'm the founder and CEO of Chartnote, and we have Austin here today. He's product expert, and we're gonna just do a brief overview of what Chartnote is about, and we'll do a brief demo. And then if you have any questions, feel free to just go to the Q&A section of the webinar, and we'll be happy to answer the questions for you. So to start with, this is our homepage. And when we started Chartnote 4 years ago, we had a really basic platform, and it was basically just dot phrases and templates. We call them snippets. And basically what the snippets are you type a brief abbreviation, like for example, here there's one for hypertension, and it will expand the block of text. So the idea was to expedite the medical documentation with this smart snippets, have drop-down menus and optionals, and then you can copy paste that to the EHR. Then we added voice recognition, and I'm sure many of you have used Dragon before. We have a very similar product. It has a really good accuracy in terms of medical vocabulary. So that was the next feature that we added. And then last year we introduced AI to Chartnote, and it's really mind-blowing what we can do with AI. So our main feature is the AI Scribe now. And what AI Scribe does is listens to the doctor-patient conversation, and then it creates a really nice medical note for you. So now if for some reason the patient doesn't want to be recorded, or you prefer to just record your note and dictate your note, we have what we call voice charts. So this is kind of like how doctors did it 10 years ago before we had the speech-to-text recognition. They will see the patient and then call a number, record a message dictating their note, and then a transcriptionist will create the note, listening to the recording, and then after a few hours you will get your note. So this is pretty much the same thing, but AI does it in just a few seconds, and we'll go over that in a minute. And then within Chartnote, we added this feature called Copilot. And what Copilot is pretty much ChatGPT, but in a secure environment and within the context of your note. So we're HIPAA compliant, so everything that you put in our platform, it's private and secure. And also the AI, the questions that you answer are going to be related to the note that you're working on. So we'll go over that in a second. So let's log in. You can always create a free account. There's no credit card needed to create an account, and you get access to all these features with some limitations, but you can use all of them. So let's see. Okay, so this is what you're going to see when you log into Chartnote. And now you can use Chartnote on your computer, but we also have some apps on the App Store and Google Play, Chartnote Mobile. You can scan this QR code if you want to download the app. And it has pretty much the same functionality as the web version. And it obviously gives you a little bit more mobility, especially if you go from room to room in the hospital or in the clinic. So you have that option. And we also have the Chrome extension, and we'll talk about that a little bit later, but it allows you to dictate and insert snippets and notes directly into any web-based EHR. So Athena, Practice Fusion, eClinicalWorks, some of the common web-based EHRs can be used with this extension. So let's go back to Chartnote. And Austin, you want to be my patient today?
Absolutely. Yeah.
Excellent. So let me see if I can share my screen from my phone. Let's see. Let's see. Okay, so let me just adjust this a little bit. So what you're seeing on the left is my phone, and on the right is the web-based version, so call it Chartnote Web. So on the website, you're going to see on the left all the notes that you have been creating, and then these 3 buttons. On the app, you're going to see a list of notes, and then this on the right lower corner, you have this big blue button, and it's going to give you those 3 options. So if you wanted to start a note from scratch, you can just open a template. Let's open, for example, this soap note, and you can start typing, you can start dictating. You can do the same on the app, and it's going to allow you to select soap, and it's going to allow you to obviously type, although that's, I'm sure it's difficult to type on your phone, but you can also dictate on your phone. So this is a 55-year-old female with history of diabetes. You can switch to the next section and keep dictating. You can insert snippets here. Let's stop this. Let's look for a snippet for physical exam. And it will insert snippets. Let me see if I have another one. Exam. Sorry. Let's see. Okay, so this one has this brackets, and you can navigate. With this. There's not letting me navigate. Anyway, we'll let me show you how it works here. So you can dictate here. There's a microphone in the upper menu. You can use the hotkey control down arrow and start it, or use. This is a 55-year-old female with history of diabetes, period. Next line. Presents to the ED with chest pain, period. And you can stop it with the same command. And then let's insert the same snippet that we inserted here. So let's see, you can do an inline search by typing the @ symbol. So let's see. So you can do that, or you can go to this snippet section, search for that same snippet, and it's a little bit, it's just a different way to search. You can also insert from here. Let's just remove this for now. Now, if you have these brackets, you can navigate using control right arrow, and then just you can start dictation with the control down arrow. Bilateral auscultation is clear, period. Anyway, so there's some voice commands, and you can explore that a little bit more if you go to the commands guide in the settings, the microphone settings. But let's move on to the AI section of a Chartnote. So this is just to create a note from scratch using snippets. Now, if you wanted to create a node using AI Scribe, you can go to the web. This button says AI Scribe, and you can just click record and start your visit. You can select a patient if you wanted to add a patient with their date of birth and gender and all that. You can do that. If you want to do a quick label, let's say you want to just to quickly label this note, you can put that there. Here in the helpful information, sometimes when you have a discussion with the patient, you don't discuss the age or gender. So let's put the 40-year-old male here. Select your template. Here we're going to use SOAP. And by default, you have SOAP selected. You can change it to a history and physical, mental health note. We have other ones like free text note and ED visit note. You can create your own. If you go to the library section, you can create your templates. We'll go over that in a second. And then if you want AI to assist you with billing, you can ask for ICD-10 codes, EM codes, CPT codes, and you can select your settings so you get the right EM code. Now, on the phone, because you have exactly the same settings. And now, before you do the visit with your patient, make sure you ask for consent. So you just need a verbal consent, and then you can say something like, "Hey, I'm using this AI app to help me with my documentation, so I can pay more attention to you instead of the computer. Is that okay?" The patient says yes. And the only thing you should do is on your note, just type something like the patient consented to using the AI Scribe, and that's enough. Some clinics like the MA to do that for their clinicians. They put a little announcement on the clinic. Anyway, so this is the AI Scribe, and like you see, you have the helpful information. Let's select the SOAP note. Make sure that we have the right language. We have over 30 languages that you can use. And let's select this billing codes. And you have up to 2 hours of recording time. So if you have a long visit, Chartnote has you covered. But let's just start recording. And let me just pause it for a second. A good tip is to put your phone on your chest pocket or between the patient and you. If you put it on your chest pocket, make sure the microphone is facing up. Those are just some tips to get better audio. So, hey, Austin, I'm Dr. Bonilla. How can I help you today?
Hi, yes, doctor. I am experiencing some pretty severe ongoing headaches.
Okay, when did you start with this headache?
Roughly 3 weeks ago.
2 weeks ago. Okay, and where are the headaches? In the front of your head, the back, one side or the other?
It seems to be kind of concentrated towards the back of my head.
Okay, and does it travel anywhere?
I mean, it doesn't seem like it just stays there. It doesn't go all the way to the front of my head, but it kind of travels towards kind of from the back towards the middle.
Okay, and did you hit your head or anything that kind of precipitated this headache?
No, there was no any kind of like trauma as far as physically.
Okay, and is it constant or it comes and goes?
It comes and goes.
Okay, and so how's your level of stress?
I mean, it's increased recently. We just had our third child.
I see. Well, congratulations.
I don't know.
And
Thank you though.
and so how many hours do you think you get of sleep?
Since she was born about a month ago, I'm probably averaging about 4 hours of sleep, honestly.
Okay. Yeah. Well, that's probably one of the contributors to this. Um,
A lot of
uh,
coffee, not sleeping. But
how much coffee do you drink?
like 4 to 5 cups a day.
Wow, okay. So you're staying awake. Try to stay awake with the caffeine. Okay, how about alcohol?
Probably like a beer like 3 times a week.
Okay, and how about water? How much water do you drink during the day?
That's a good question. Maybe 2 or 3 glasses a day.
Okay. Okay, and exercise?
I biked my middle child to school about 1.5 mile round trip, uh, probably 4 times a week. So
Yeah,
3 miles of bike
uh,
riding times a week.
that's
So
pretty good. Okay, well, let's do a quick exam. Let me take your blood pressure. Your blood pressure seems to be 150 over 90. That's a little bit high, but um, and then your pulse 88. That's good. Let me take a quick listen to your heart.
oh, that's cold. Wow.
Sorry, and okay, that your heart sounds good. And take a deep breath. Okay, so your lungs sounds clear, and I don't see any swelling in your legs. Let me touch your belly really quick. Any pain? No.
No.
Okay, and let me take a quick look at your eyes. Do you use glasses?
Yes, I wear contacts primarily, but I do wear glasses at night and sometimes in the early part of the day.
Okay, when was the last time you got a new prescription?
It's been over 2 years.
Okay, okay. Okay, just follow my finger, and okay, that's pretty good. And let me just check your neck really quick so I don't feel any lymph nodes. Okay, that's pretty good. You can move your head, say yes and no. Okay, any pain there?
No,
Okay, so you
a
have,
little sensitive, but yeah.
okay. Yeah, I feel a little bit of tension there in your neck, but you have full range of motion, so that's good. Anyway, Austin, so have you been taking any medications for the pain?
I've had a little bit of ibuprofen when it gets really bad, specifically if I'm trying to like go to sleep. But yeah, that's about it. Ibuprofen once or twice a day.
Okay, and do you take any other medications
Um,
or supplements?
no, that's it. That's the only medication I take other than vitamins, daily
Okay.
vitamins.
Well, so your blood pressure is a little high. I don't know if it's related to your headache or maybe the ibuprofen you've been taking. So I will advise that you switch to Tylenol instead of ibuprofen.
Okay.
And uh, do you have a blood pressure machine at home?
I do not, but my wife is a nurse. That
Okay, well, maybe see if she can check your blood pressure at home. Your blood pressure was a little high today.
okay.
But we'll keep an eye on that. That can definitely cause headaches. It seems like your headache is caused by the lack of sleep, and maybe you're drinking a lot of coffee, which is probably related to the lack of sleep and maybe a little bit of stress. So nothing to worry here. I mean, I'm sure as the baby gets older, you'll be able to sleep a little bit more. But try to get as much help as you can, so you can get some sleep and continue with the exercise and drinking water. Your alcohol consumption is it's okay. But I think what I want to do is take the Tylenol when you have a headache. Try to get at least 8 hours sleep,
Okay.
and then come back in a couple of weeks. I just want to make sure that your blood pressure is back to normal. If not, we might consider starting some medications, and just write down the medication, the blood pressure that your wife takes, and we'll review it when you come back. Sounds good?
Do you want me to have her do like daily checkups on it on my
Yeah,
blood
yeah,
pressure?
daily sounds good.
And just note that. Okay, sounds good.
Excellent. So I'm gonna stop this, and if you were an ED physician and you order some labs, and then you have to come back to the room to discuss it, you can always just go back and save it, and it's going to be there waiting for you, so you can come back and resume the recording, discuss some more information, then just hit transcribe. Let's see, I'm going to add your age here, 40-year-old male. Okay, it's going to take a few seconds, and we should see it. Yeah, so now on the right side, you can see the notice processing. And you can see the same thing in the phone if you refresh. Okay, so since it's ready here, so let me just expand this. Click on the note, and let me zoom in. Let's see. So, we have a pretty accurate history since everything we discussed, it's included there. We have the vitals, the exam, and then the assessment plan, the billing codes. So, you get a pretty good note. Like I said, you can create your own templates. So let's say that you want to separate the assessment and the plan, you can definitely do that. And that can be found in the library, but well, we'll check that in a second. So if you needed to edit, let's say, obviously you can type, you can dictate. Patient has family history of diabetes and hypertension, period. So you can always edit, and obviously make sure that you read the notes, make sure it's good. And then the next step is probably you want to transfer this to EHR. So you can see these little copy buttons. You can copy section by section, or if you click on this button, you can copy the whole note. So depending on the kind of EHR that you have, I have here a demo EHR that has divided by sections. So I would copy the first section, paste it on the subjective part, then go for the objective, and then the assessment plan and so forth. Now, if you're using a web-based EHR, we have a Chrome extension that you can use Google Chartnote Chrome extension, and it's super easy to install. It's one click, and that's it. You're gonna see it here on the extension section of your Chrome browser, and you're gonna log in, and you're gonna see this, and it's basically a condensed version of Chartnote that works in your EHR, and it can work in conjunction with your EHR to dictate. So, for example, so you can turn on the microphone here, and then let's dictate hypertension, colon, uncontrolled, period. We'll follow up and monitor at home, period. Sorry, you have to select where you want to insert the text. Anyway, so you can just dictate your note using the extension. You can insert snippets. So, for example, if I type at hypertension hashtag, that's my snippet for hypertension plan. Click tab, and it's gonna expand my snippet. If it's if you don't remember the extension, you can always open the extension and search for, let's say, atrial fibrillation, and click on it. If it's a more complex snippet with optionals and drop-down menus, it's gonna open this pop-up. You do your changes, and then you insert the snippet. It's gonna be inserted there. If you want to insert the AI Scribe note that you just created, you can also find it there. So you go to the note section, and you're gonna click, and it will insert the whole note. So that's a way of transferring the note to your EHR. The other thing you can do with Chartnote is create a after visit summary. So if you go to the Copilot tools, you see this after visit summary. And let's say this is for the patient, and I want an advanced level. And if it's a language different than English, you can select here, click OK. And it's going to create an after visit summary for you that you can use, print for your patient, and all the instructions that we gave to our patients are going to be there. And it's super easy to use. Now, we have this Copilot tool. If you wanted to ask a question to our AI chatbot, it can be anything. We have some samples here, but let's say that we want to create a meal plan for my patient to control his blood pressure. And it might give you some ideas that you can use. But you can use this for anything you can think of. Any question, if you want to ask for doses of medications, differential diagnosis, anything you can think of, you use as the AI, and it's in the context of the note. Okay, what else do we have here?
What you're saying is I need to get some dark chocolate covered walnuts in my body. Gotcha.
That's what it said?
Dark chocolate, and it said walnuts, so I didn't remember.
Let's see. Meal plan. Okay, let's see. Hydration, caffeine reduction, and alcohol moderation.
Evening snack, dark chocolate. I swear I saw walnuts.
You know what? Oh, here. Yeah. That's nice. It's pretty generous. Anyway, so that's Copilot. That's AI Scribe. Now, let's go back home. Some doctors don't like recording the visits, or maybe the patient doesn't consent. So you have the option of doing voice chart. And what voice chart does, it uses pretty much the same technology, but the idea is that you record yourself dictating the note. So let's do that really quickly. You have a similar set of options, and I'm gonna just click record and start dictating. Obviously, you can do the same thing on the phone. This is a 40-year-old male coming to the clinic complaining of a headache for the last 3 weeks, located on the back of his head with no radiation. It's intermittent. He reports some increased stress levels, only sleeps 4 hours at night, has a newborn. He exercises and drinks plenty of water and moderate amount of alcohol. On exam, it's pretty normal. His blood pressure was 150/90. Assessment and plan hypertension, we're going to monitor at home, and patient will return in 2 weeks. Headache, likely multifactorial, related to lack of sleep and stress. We'll recommend it to avoid using NSAIDs and use Tylenol instead. And he's gonna follow up in 2 weeks, like I said. So let's stop. As you can tell, I went back and forth and stop and so you can just start recording yourself and dictate. And the difference between this kind of dictation using AI versus what we used to, which is the speech to text live dictation, is that you can stop and continue dictating, and if you forgot something about the history, you can go back and say that, and then at the end it's gonna give you a really good note. If you start doing that on the regular dictation, it's gonna be full of blank spaces and things that they didn't recognize. So let's transcribe the note, and it should be appearing here in a second. Let's give it a Do you have any questions in the Q&A so far?
No.
Okay, so we got a pretty good note from our dictation, and now let's go back on the templates that you can create. So if you go to the library, you're gonna see we have a snippet library, and you have your own library. Chartnote, when you create an account, by default, comes with over 1,000 templates that you can use. If you go to your library, you can create your own snippets. And we have a community and there we have thousands of snippets. And you can, if you can search for snippets, and then if you like one, you can import them into your account and edit them as you like. So now if you want to create a new template, and these are the templates that you create just to do notes from scratch. You can go here to the template section. Now what is really powerful is this AI powered note templates, where you can really customize and tell the AI how you want your note. And this is something that distinguishes Chartnote from other AI scribes, because you can, like for example, I like using this one myself. So I'm you put the name of your template, you create some instructions in general for the note. So I tell it that write in the style of a family doc. I tell them how to use the acronyms. So anything general about the note you can include here. Here's some ideas of what you can do here. And then you add sections. So to add a section, just click here and you add a section. And you can add custom instructions by clicking here. So let me just show you what I did with this one. So for my subjective, I asked the AI to write like a single paragraph. That's the style that I use. Include all the pertinent information, vital labs, and imaging results. So that's how I like my notes. You can write how you like your subjective section. It can be that you can use bullet points or different style. You can have subsections. So if I wanted to add a subsection here, I click here, and let's say that I want to do some past medical history, and then another subsection for a past surgical history, and another one for review of systems. So if I wanted that for my note, I can do that, and then the AI is going to create a note that looks like that. So let me just get rid of this so I don't mess up my own template. And then on the objective, you could put a template that you want the AI to follow, and then you can say to adjust depending on what the encounter that you had. So I like using that. It's super powerful. So you can put complex instructions and the AI is going to follow it. For my assessment, I told the AI to put the ICD-10 codes as a list, and then a sample of how I like my assessments. On the plan, I like to use bullet points, so I told the AI to use that. And then I wanted my note to include some patient instructions. So I just told the AI to write these instructions, and it does a pretty good job at that. So you save the template, and then next time you do your AI Scribe, you make sure you select your template. So, and then it's going to use that template. And you can create any sort of notes. I just recently created this one. It's called meeting. So when we have meetings, we use this, and then I asked the AI to do some tasks, and for everyone, the tasks that were discussed during the meeting. Anyway, so it's you can do a lot of things with this custom AI templates.
Dr. Bundy,
Yeah.
can you go back to the template and show us how you went from? Did you do something special to get to your custom templates? What did you?
Also, I went to home, and then I went to library, and it's in the AI powered note templates. And here you will create a new template, and then you start from scratch, and then you.
But so say you can you show your phone on the screen here? Share screen.
Let's see.
You open up Chartnote, and then say you're going to start a new AI Scribe.
And you will select your template.
Yes.
So this one is the one that I.
Okay. So you just click. It's on there. It's just that there's no additional click. It's just once you save that template, it's on there. So.
And then if this is what you're gonna use all the time, after you use it one time, it's gonna automatically save your selection, so you don't have to go back and select all your options again. So if you create your customized template, you're good to go. You start using it, and you forget about it.
And you can clearly, obviously, title it whatever you want. So it's just like, hey, this is my go-to template.
Yes, you can. Sorry, my wife is calling me. So yeah, you can call it whatever you want.
Okay, sounds good.
Okay. Anyway, so what else? So we cover the Chrome extension. Let me just make sure I'm not missing anything. Let's see. We cover the apps, the custom notes extension. Yeah, well, let's just cover the pricing. Well, before we cover the pricing, you see this big blue bubble. You have customer support 24/7. You can chat with us here. There is learn section with a lot of video tutorials that you can watch, and we have a help desk. So there are some good articles there that you can also use to if you have any questions.
One question. HIPAA. Are we HIPAA compliant?
Yes, definitely. So if you want a business associate agreement specifically for your team, you can reach out and do that. But by default, everyone it's covered. We're HIPAA compliant, and so the billing, we have 3 different tiers. Everyone starts with a free basic account, but you can upgrade if you want unlimited use of snippets and templates. You will get a premium account. If you want unlimited dictation, speech to text, you will get a professional account. And if you want an unlimited AI assisted node generation, you probably want to get the max plan. And we have monthly and yearly plans. So if you go for a yearly, you get a discount. And then the teams, if you want to bring your team from your clinic or hospital, we can do that. You have an admin account that can add or remove users. You have a single consolidated billing and other admin tools at your disposal. Excellent. Well, I think we covered everything. Thank you for your time. And if you have any questions, feel free to reach out.
All right. Thank you.
Okay.